Kristen, can you give us a sense of like what is the scope of nurses being affected by substance use here in the US?
Yes. So right, we're not alone in this, certainly. The American Nurses Association says that about 10 to 15% of nurses struggle with some form of substance use, and 6 to 8% of them are working impaired, which is the really concerning statistic. I like to put numbers to that because I think it makes it a little bit more impactful. So in the United States, we have about 5 million nurses, and I like easy math, so I round things off. So about 5 million nurses. And if we use the lower of the two statistics, so 10% of nurses struggling with some form of substance use issue, that means there are 500,000 nurses in this country that are struggling. If we look at the second statistic, that's 6 to 8%, 6% of nurses are working impaired. That means there are 300,000 nurses in the United States that are working impaired. In other words, working under the influence of drugs or alcohol to impair enough to impair their practice. That was certainly me at the end. I was taking that fentanyl at work probably for the last couple of months that I was there and diverting. Those are the nurses that we need to reach. Those are the nurses that need help urgently, emergently, before they end up in a tragic situation, either hurting themselves or hurting a patient. That isn't why we went into nursing. We didn't go into nursing to hurt our patients. We go into nursing because we want to care for people and make things better for people. And we need to make things better for ourselves first, so that we can then, be a little bit better caretakers at work.
Yeah, I hear that number as 300,000 nurses needing care themselves. And that's quite striking. I'd like for us to talk a little bit about some of the factors. I feel both of your stories really reveal some of the contributing factors to substance use. April, you've done a lot of work, especially around workplace factors, and you've got a research paper where you wrote, even under normal or non-COVID circumstances, nurses are exposed to multiple risk factors for addictions, including highly stressful work environments, easy access to drugs, negative attitudes towards patients struggling with addiction, and the strong conspiracy of silence that covers up the reality of substance use disorders. These factors come together in a perfect storm, endangering patient safety and sometimes ending the careers of some of our most engaged nurses. Can you maybe expand a little bit on what are all those workplace factors that really come together as the perfect storm?
Absolutely. So, first, I want to say I love how Marie Manthe explains the perfect storm in her article, Substance Use Disorders and the American Nurses Association, A Call to Action. That's the article that you're referencing. She highlights how all these different things or all these different factors really line up in like this perfect way that not only endangers the nurse, it endangers the public. And for me, I want to start by saying, first and foremost, it was the shame and stigma that was related to substance use disorder and my problem drinking. And what I really mean by that is this had to be my secret. When I would come to work extremely hungover or ill from my drinking, or if I was going to need to drink after my shift, I didn't talk about that with anybody. Nobody knew that that was what I was dealing with inside, because if they did, I felt as if, and I had seen and experienced other nurses around me, their licensure would be destroyed. They would lose their job. I would not have money. I wouldn't be able to feed my children or have a home over my roof, or a roof over my head, a home to live in. And that's a big secret to have to hold and to try to figure out how to navigate your way through something like that when you're afraid that if anyone knew that you were drinking the way that you were, that your life would be over and you wouldn't be able to survive. The next thing I want to point out as a perfect storm for me was similar to the mommy wine culture. It's this phenomenon where there was not only normalizing of drinking in the culture where I was working as a nurse when I was having a lot of my problems with drinking, there was normalizing, there was glamorizing it, and there was even an encouragement to go out after work or to go out on the weekends together and really drink a lot because it was helping all of us cope with a lot of our related stress. And so when other nurses saw that I was sick the next day, or when other nurses were sick themselves and it was, oh, we're hungover again today, it really was, it was almost, it not only was it accepted, it was funny. And we would talk about how we were gonna nip it the next time we went out and get on top of it with more alcohol. And so as a bedside nurse, I did transition into a leadership role. And the last thing I want to point out as that perfect storm with my progression with my alcohol use disorder is when I was a nurse manager, after all of that experience in the acute care setting, I was introduced to a whole new level of burnout, isolation, fear, judgment, targeting, people hating me just because of my title as a nurse manager. And that really was where it ended up being the all-time low for me, where I needed to surrender and get that help. But hopefully you heard that we call it that Swiss cheese phenomenon, where all the stars were aligned, all the holes were there for this alcohol use disorder to really make its way through to my deepest despair.
Kristen, is there anything you want to contribute around, yeah, workplace factors that you think really adds to this within nursing?
Yeah, well, I realized that I came to nursing with a predisposition to using substances for coping. Like I came to nursing with that. I think it's important to know that, and I think it's important for new nurses to recognize that about themselves. I also worked in pediatrics, as I mentioned, and we dealt with a lot of very tragic cases, but we did not very often talk about or deal with how difficult that really was. We just kind of went on to the next tragic case. Uh, we didn't, I should say, we did have some debriefing that we did sometimes, but it was very high level and not very deep. Really just, I think, for them to check off a box saying we did it. Or maybe we just didn't take it seriously. There's always that too. I never took breaks. There was a general understanding that we didn't take breaks. I mean, we would like high five each other at the end of the shift if we hadn't gone to the bathroom or if we hadn't had something to eat or drink. Like we were, woo, I made it the whole shift. That is not something to be proud of. The only breaks I really took were to smoke. I smoked cigarettes at the time, another great coping skill I had. And so I would go outside to do that. But other than that, I did not really take a break. I would eat on the run sometimes, but I rarely took vacations. When I did take vacations, they were all around drinking. Like it, drinking was always, or drugs if I had them. That was always the thing that made everything else better. I didn't deal with any of those things. I didn't think about the fact that I didn't have breaks. Like none of that really occurred to me. I buried all of that under the alcohol and drug use. I buried any feelings that I had with another beer or another shot of fentanyl. Like it was just to stuff all of that down. I certainly wasn't the only one, as we've heard in the numbers, and April and I can attest to, not the only one who does that. Like healthcare is riddled with that culture, that drinking culture. I have the same stories about, back then going out drinking after work or going to parties and drinking until I was blacked out and talking about how funny that was the next day, like my peers. And I would, ha ha ha, that's hilarious. And it isn't funny. It isn't funny. And we need to change that. We need to start dealing better with our feelings in a healthier way.
Yeah, I mean, I remember same as a young physician, there's just no space to say how you're feeling, and so you try and numb it. that is the strategy. You go through a 36-hour shift, and like you, I think I had a 36-hour shift once where I had 30 minutes somewhere in the middle of the day and 30 minutes somewhere in the middle of the early morning hours that I ate some food, and that was it. And the rest of the time you were just on. And my coping strategy was to go home, cry my eyes out, eat a bunch of chocolate, and watch a really sad movie. But somehow you wear it as a badge of honor. So tomorrow morning you're back there and you're doing it again, and everyone's like, "Great, you can do this. So let's just keep going." So I think no matter what it is we turn to, if we can't verbalize how we're feeling about these things and have space to actually process, like you say, one's emotions, it becomes risky for us. April, you spoke about how it started for you, where you feel it's almost from the age of 12. And as health workers, we are more than just our jobs and our workplaces. What other factors do you think in your life contributed to this becoming the strategy, look, turning to substances as a way to finding relief?
I love how we're incorporating this because I had to learn at one of my recovery sites that I was at that I'm actually not a nurse first. I'm April first, and I'm a nurse next. And I had a huge life outside of what I was doing at work that was contributing to my problems and my problem drinking. I was a young mom, and I mean, I wasn't necessarily young. I had young children, I should say. But I was a mom, and I had two babies in 1 year because I had a diagnosis of cervical cancer, and I needed to have an emergent hysterectomy after my babies were born in 1 year. They're Irish twins. And I had a struggling marriage, and we had a struggling business that we were getting up and running. I was going back to school after having these babies and having this hysterectomy and a cancer diagnosis to try to complete my 4 year degree, my BSN in nursing. And I was trying to balance work and life and friends and partying and trying to learn how to be a critical care nurse, and then going back to get my parts of my MSN. And so I'm a high achiever even though I had a alcohol use disorder, and I had this blooming family and all these personal issues, and I had all this growth at work, and it was all happening to me at the same time. And so it wasn't just the nursing aspect of things, it was just a part of my whole pie of problems that were contributing to the way that I was not coping in a healthy way.
Kristen, how about for you? What of that resonates with you? What was your experience like?
I think my issue started when I was young. We were taught very early on that it was not okay to show your feelings or to say something was bothering you. That whole, stop crying or I'll give you something to cry about was common. Like literally, my parents said that. So I learned to shut my feelings off very early on. So when I found, and I mean, that resulted in anxiety and depression in my teens and, early young adult life. But I learned when I went to college and I had that first experience with alcohol that that made all that better. Like the alcohol made all of that go away, at least for a little while. So once I realized that, I sought that out until I felt better. Uh, that culminated, of course, in my diverting and getting fired and all of that. But also in that was my marriage. I told you that was not great. I ended up with a divorce right around the time I first tried fentanyl. So I imagine that made it more appealing, that it made the feeling more appealing because I felt like such a failure, not being married, like not being successful, having a successful marriage. I was really afraid and anxious because I had a second daughter in my marriage. So I was going to be a single mother with two daughters. I had no idea how I was going to cope with that or what that was going to be like. I was severely depressed after the divorce. So all of that played into it in addition to having, a difficult job, work dealing with all of that trauma at work. Substances made all of that tolerable. until they turned on me and became my, nemesis.